It's been almost 2 months since the 67th legislature started, and things are not slowing down. Abby Davis looked into several bills making their way through the Statehouse today. Abby, two are health related.
Right, one's about access to health care, the other about a state drug program. A bill proposing changes to the ballot initiative process also moved forward today. A House committee sent a bill prohibiting kids and teens from accessing health care without a parent's permission to the floor Tuesday. Medical emergencies are the exception. ACLU of Idaho Advocacy Director Julianne Donnelly-Zuhl thinks the bill targets the LGBTQ community. She also worries about kids and teens with abusive families.
If you have a child who is needing help, but whose parent is not necessarily a safe person for them to go to, or who doesn't advocate what they want to do with their own body, there should be a way for that child to articulate that need, and this bill takes that away.
Co-sponsor Barbara Ehart says the bill doesn't affect Idaho's abuse reporting laws, meaning kids and teens in unsafe situations could still get the help they need.
Some of these other circumstances and things that are taking place, these secret conversations that are happening without the parents' notification, we need to stop that. Involve the parents, and you know what? Idaho will be a healthier place when we do that.
Lawmakers also voted to send House Bill 652 to the floor, which would change the requirements for getting an initiative on the ballot, including moving the deadline for gathering signatures up a month, making organizers turn in signatures to the county clerk monthly, and adding a 2-month public review period where people who signed the initiative could take their name off. Sponsors argue the bill increases transparency. People against think it makes the process harder. A bill aiming to get rid of Idaho's Syringe and Needle Exchange Act continues to draw controversy. It's on the Senate side after passing the House floor Monday. The act allows organizations to exchange clean needles and safely dispose of old ones to help prevent disease and encourage treatment. The Idaho Family Policy Center supports the bill.
The best support for drug addicts and those struggling with addiction is to give them opportunities to overcome their addiction rather than to continue giving them tools like needles that would enable them to continue their addiction.
But Representative Nate Roberts says the act protects people struggling with addiction.
They're trying to measure it based on number of needles or number of syringes rather than measuring it on providing an opportunity for individuals to clean themselves up to achieve sobriety.
Roberts does agree the program needs some fixing. Last month, Boise police searched a nonprofit that uses it. They were looking for drug paraphernalia. Roberts thinks the legislature should have more power to oversee reports about the program and to make sure things are by the book. But he says repealing the act entirely, Morgan, would just set Idaho back.
All right, just several more bills that we are following in the Statehouse. Abby Davis, thank you.